I'm calling from Lagos.
Okay.
Yeah, my company is the Honest Global Freight Limited. We are into training of intending exporters and importers. We also help clients market them to international buyers, and also we help them to locate foreign exporters who are trying to export into Nigeria. So we do like matchmaking.
So how can we reach
Hello?
you?
Yeah, I'm listening on 090
Mhm.
33 10 439.
Thank you. Signals Marketplace, your name, your location, what are you selling, what's special about your product, your service, and how can we reach you? Your WhatsApp line is fine. If you're tuning in for the very first time, it's Signals Marketplace. So we pitch and sell in 30 seconds between now and 10:15. So I have like 4 to 5 minutes to go. So we have more time to call and sell our businesses. 009 191 3913 or 01 5151 913 or 01 5150 913 009 191 3913 009 234 5913. Your name, your location, what are you selling, what's special, what's unique about your product, your service, and how can we reach you? 01 5151 913 or 01 5150 913 or 01 5151 913. Signals Marketplace 01 5151 913 or 01 5150 913 or 0809 234 5913 or 0809 191 3913 or 0809. Hello, good morning.
Hello?
Hello, good morning.
Good morning.
Your name or where are you calling us from?
This is calling from the country.
Okay, what are we selling?
Okay, I want to
I can.
some land, and we are selling in acres, and it's very affordable. So people don't want to do something in a quota. So the per acre is 970 per acre. So the transition on this number 07038768209.
Okay, is one. If you're a woman and you have a business, please, I'm waiting for you. All these men are just calling. It's not nice. So 009 234 5913 or 009 191 3913. I have 3 minutes to go. Hello, good morning. Hello.
Good
Hello.
morning.
Good morning.
My name is Ariade.
Okay. Where are you calling us from?
Yeah, I'm calling from Oba.
What are we selling?
Yeah, we're into ready to wear bespoke fashion for plus size women, comfortable wears.
So how can we reach you? Your WhatsApp line.
All right, so you can reach us on 081 75 34 33 77.
Say that again.
Hello, can you hear me?
Call it again. Call the number again.
Yeah, 081 75 34 33 77.
Thank you. Signals Marketplace 0809 191 3913. Please, I want to hear a woman's voice. Please, please, please. Oh, please. 009 191 3913 or 009 222. That's two in three places. 0913. Hello, good morning. Reduce the volumes of your radio set.
Yeah, hello, good morning.
Good morning.
My name is Ololade.
Okay.
I'm into any kind of metal craft. If
tax application.
Okay.
So you can reach me at the 070
Mhm.
62
Thank you. 015151913 or 015151913. Your name, your location, what are you selling? What's special about your product, your service, and how can we reach you? Your WhatsApp line is fine. Hello, good morning.
Hello, good morning.
Good morning. Your name and where you calling us from?
My name is Tosin Oshinoga, and I'm calling from Oba.
Okay. What
So
are
we make bespoke cakes, cupcakes, meat pies, all the work.
Okay. So how can we reach you? Your WhatsApp line.
080 355 98754.
Thank you. Signals Marketplace, 2 minutes to go. 2 minutes to go. Your name, your location, what are you selling? What's special about your product, your service? And if you want to sell on behalf of someone, that's their Easter gift, Abi. Call us now and tell us what the person is selling. Your name, your location, what are you selling? What's special about your product, your service? And how can we reach you? 015151913 or 015151913. Signals Marketplace 00923459113 or 08091913. Signals Marketplace, your name, your location, what are you selling, what's special about your product, your service, and how can we reach you? 1 minute to go, 1 minute to go. 00923459113 or 08091913. Hello, good morning. Hello,
Hello, good
good
morning.
morning. Your name and where you calling us from?
My name is Prince.
Okay.
I'm I'm calling you now from Godo.
Um,
Then we are into event planning, marriage, or anything celebration. And if you want to reach me, is 080 913
thank you. 015151. Yeah, I can still spare one extra call. 0151519113 or 0809. Hello, good morning. Oh, call back. Let me wait for you. 0151519113 or 080923459113. Hello. It's not me. It's not me. Call again 0151519113 or 08091913. Going about to go 0151519113 or 009. I just hope it goes. Hello. Okay. Hello. It's not me. And that's it for Signals Marketplace. We'll be right back. Don't go anywhere. Okay then. So it's now time for us to
How long have you doing this?
I will go straight 1 and 3 house to eat.
13
Yeah. Then let's go. Let us go. Enjoy this movie.
Oh, you're still calling?
It's just that
Yes,
Tayo
yes.
will not
Yeah,
start
but
to stop me to
it's
turn on
very
my
good.
Wi-Fi for him.
So let me
You
just
can
set you
enjoy data bonus with
up like
MTN
this.
for me. With MTN for me, you will get 100% data
Are you sure you're going
bonus
to
and
start?
No, I
discounted
understand. Don't
data
worry.
bundles
I'm
just
trying
for
to
you.
push it.
What are you waiting for? Dial star
I want to see
121
your
hash to get
face.
started with MTN for me.
I'm not too far away.
No, don't worry. Yeah, where I need it to be.
There's a new cuisine in
I'm
town.
trying to do
A
something.
glass
That's
of wine,
finished.
a
That's
cup
go.
of coffee, and
Okay,
if you're
everybody
like me,
going.
a glass of smoothie. with signals served on Lagos Talks 91.3 every Saturday at 10 a.m. Your mind will dream again.
Okay. Yes, yes. Welcome back to Signals on 91.3 Lagos Talks. This morning, thank you, Uncle Yomi. This morning we'll be looking at healthcare, the ever-evolving sector. It's always, if people are not living, yeah, people are living. The doctors are living. I have with me someone. So I'll try and put some two paragraphs together. Is a highly motivated and very resourceful doctor. He has a passion for writing, teaching, and traveling. And in the not too distant future, he hopes to become, well, he has become what he has written anyway. So let me just come down. He came about this journey, medical practice, as a result of the things he had been through, and also because of his personal quest for knowledge. He has a passion for He has a passion for patient care and a passion for creativity. When you put that together, a rare opportunity is born. You realize that the ability to make a difference between sickness and health is one of the greatest forms of wealth, and that doesn't stop as long as it continues to strive to get better. His name is so wait, he's a director, Atlantis Pediatric Hospital, and the CEO of Celebrity Platinum Group. He's also a specialist family physician, and then he's also a businessman because some of the conversations we're having before we came on air was just jotting. So his name is Dr. Ololade Diya, and his quest for excellence is insatiable, and all he wants to do is promote everything. There's something I saw. He has nothing to offer but his blood, toil, tears, and sweat. Welcome to Signals, Dr. Diya Ololade.
Thank you very much.
Yes.
Good morning.
Good morning.
Happy Easter.
Now we're going straight to.
Let's keep this on.
No, don't keep it on. Remove it. Let people see your face. We're coming to the doctor, so we're coming to your space, and we'll be asking now because you're a doctor. Let's even start with the nagging. So recently within the week, the reps, our also rep decides that we have to stay 5 years first before the doctors will jump. What are your thoughts?
Okay, so now, firstly, I need to make it clear that I am not a politician.
Obviously.
Yeah. So they can pass anything they want to pass where they are gathered. But now the thing is, I'm just trying to see. I'm trying to fathom what exactly was at the back of their minds when they were talking about keeping medical practitioners for 5 years after all the stress they have been through. Yeah.
Go ahead.
And I think it is not only illegal, yeah, but I think it's actually against human rights. Because as a doctor, you can go wherever it is you want to go to.
Okay.
Now, I picked something from that video. I watched the video also, and he was saying something about the federal government subsidizing the medical training. I went to a private university, and I paid top dollar. So my father, God bless his soul, I paid an arm. He paid an arm and a leg. He had to send me through medical school, and I didn't get any subsidy from, unless they want to give me now. Yeah, because I'm like, 12 years post medical school already.
Now, the ability to, and which we picked from the profile, the ability to make a difference between sickness and health is one of the greatest form of wealth. Explain.
Okay, so the ability to make a difference between sickness and health.
Sickness, health.
No, so now the thing is, by definition, WHO defines good health or total health as a state of complete mental, medical, psychological. Now they're trying to add spiritual well-being, without the absence of infirmity and absence of sickness. You will not know how important that cough will affect your business if you have a presentation and you have this cough and you cannot talk. Yeah, it will be almost impossible for you to
function.
Yes, that is one. Two, people who have been through proper health challenges will tell you that health is wealth, because even a simple headache takes everything away. That's why we are saying that there's a thin line, but it is very, very important that you stay healthy. We don't want anybody to be ill or to be sick.
From a family of doctors, because yes, you said daddy, mommy, everybody, doctors. They said there's nobody who took another profession.
No. We have chartered accountants in my family.
But
We
at
have,
least the major top one is doctors.
well, and funny enough, it was. I would not say it was by luck or it was destiny. I grew up living in hospital. You know, from school you go to hospital. So it's always been
You had seen
my
it.
cycle. Yeah.
Now let's forward into the future. Anytime we hear pediatrician, anytime we hear pediatry, everything is around children, right? And one of the things I read is being a specialist family physician. Tell us more about that.
Okay.
Yes, so
So
we are now inside the hospital now. So
so at Atlantis Pediatric Hospital is actually located in the center of Lekki. It's a one-stop center, purpose-built, 40-bed.
I'm not talking about business now because
No.
you're about to head into
No,
wait first.
I want to explain
Okay.
the scope. Yeah.
Okay.
Yeah. So I need to say what Atlantis is about first. So
Like a
Atlantis Pediatric Hospital is the birth child of a power couple. I don't know if I'm allowed to mention their names.
Sure.
Yeah. Mr. and Dr. Mrs. Owaje. Yeah. So the idea behind it was to build an only pediatric hospital. You know, different hospitals have visions and missions. Most big hospitals want to discourage medical tourism in quotes. Yeah. But what we are trying to do at Atlantis Pediatric Hospital is that we are trying to carve a niche for our own people in that same community, reaching out to children first. Now, when I came into the picture, yeah, it now became maternal and children, then everything else involved as a family physician. Yeah, so it is basically pediatrics, but everything you want to think of in a medical facility is present.
Now, when you say children are very most times children need to go to the hospital for one thing or the other.
Yeah.
Tell us a bit about children.
Okay, so
because you said family and
yes.
and there's something you said that piqued me, and I said, okay, we're going to talk about children, family.
Okay, so with children, there's this consultant, professor of mine in medical school who used to say that he's not a pediatrician. He used to say that pediatricians are like vet doctors. You know, the baby cannot talk, just like you taking your dog to a vet, you know. And when we came into the picture, you know, as a pediatrician, you see a child. The child can not come to the hospital by himself or by him herself. So either the mother or the father brings the child to the hospital. We are trying to see how we can ensure that the family dynamics is functional because everything starts in the family.
Yes.
Everything starts in the family. Those in, I'm not saying this to disrespect anybody, yeah, but those in the House of Reps, those on the streets, those on, if their families were appropriate or were functional, there's a chance, a high chance that the individual is going to thread through a particular path that is successful. But we have a lot of dysfunctional families starting from children. That's what we're trying to breed. We're trying to breed an environment, a continuous environment where people get what they need, not only health-wise, but generally to function as a family.
Now, what's the common challenge that you see with children when they come to the hospital? You know, they say sometimes children can't really tell you what's really doing them and all of that. And then you see a child, nothing is wrong. They don't have any health challenge, but they're just uncomfortable. And then after they've used all the medicine that they need, they still bring them down to the hospital. When you have interactions with children, what do you see? Because you mentioned dysfunctional. Is it this? Dysfunctional, right? And children come to you and they can't explain to their parents what is really going on with them. Sometimes, what do you see?
Okay, so I'm not a pediatrician. I need to make that clear.
Yeah, right.
I'm a family physician.
Family, is family.
No. so for the pediatricians, the good thing about Atlantis is that the kind of pediatricians that have been gathered, or that have been the kind of team, if I could use that word, that has been put together. The kind of pediatric team that has been put together in that particular facility is even amazes me. It amazes me because now these pediatricians are so trained to the extent that they will not only deal with the patient in isolation. There's what they call the biopsychosocial model of care. Wait, just
You explain it. You
so
explain it.
the biopsychosocial model of care is actually a family is a family medicine thing. It's a situation whereby you are treating an individual, but you are not isolating that individual from his or her own environment.
Okay.
You are including the environment, the family, where he or she has been, what he has been doing in the past
2 years.
few years, you know. You understand what I'm saying? So that's how it is. So these pediatricians are so trained that they don't only even deal with the
Physical.
ailment. They go to town. They go at length to what's happening with the family, what's happening with the parents discordial, what's happening with, because you know at which position is that child, because you know there are issues with firstborns, there are issues with secondborns, there are issues with I'm telling you. And yes, and they develop at different ways, and not every child is the same thing.
Yes.
You know, so like I said,
But you know, because of the culture that we're in, you're saying, as a doctor, you're saying that not every child is the same.
yeah,
The Nigerian mother and Nigerian father is telling you that all of you, everybody's the same.
and they made that was a grave mistake.
Yeah.
That it was a very huge mistake.
How
that
do
they
we
made.
correct that?
So what we're trying to do as physicians is that we are trying to give a lot of counseling, health counseling, to these parents on how to treat or how to administer care or foster love and care to to each child.
In the era where any little ailment you are googling.
No, so you can Google whatever it is you want to Google.
Okay.
Yeah, you can even
because you know that there's that challenge.
Yes, I agree. Now you can Google whatever it is you want to Google, but there is a chance that you will run into trouble. Half of the people who have come to the hospital have Googled initially, yeah, run into trouble, make the issue or the ailment more difficult for the physician to figure out. Yeah, but we still figure it out one way or the other.
Now, while you speak about these physicians, top of my head, I'm wondering, with half of the doctors that have left this country, do we still have doctors?
No, so we still have doctors. So now the thing is,
because there was a particular day, I for some reason I was on there. I'm like, thank you to all the doctors who have stayed, because it's almost as if by the time you go to the hospital, everybody, the next doctor you're seeing has gone.
So you know, but it's happening in the banks.
Leave bank. They can always train people. You know, they can always train people. Banks can always quickly train people. You cannot quickly train somebody through 7 years of housemanship. Is it 4 years? And especially
Okay, so what happens in the healthcare is, I don't know if you can remember this situation when someone, I think it was a minister of labor, came on TV and said that there were too many doctors, that's why we're exporting. Yeah? He said that.
Yeah, I know.
Of course, it's a fallacy. It's wrong.
We don't have too many doctors.
Of course we don't. Now, my issue, I had to actually go back and do some research. I realized that people are not, young people are not applying for medicine in JAMB.
No.
Yeah. So we are going to.
We have to go back to secondary school.
No. From secondary school, most people are not applying to JAMB to be a doctor. You know, initially it was
doctor, lawyer, accounting.
Yeah, but now with content creation, with TikTok, and you know, you can sit at home and make YouTube.
TikTok doctor.
You know, so what I think, and the reason we need to identify why Nigerian doctors, because Nigerian doctors are the best doctors in the world. I must tell you, sincerely.
Okay, so let's give them their flowers, right?
Yes, I must tell you that. So the reason why they are going to the abroad or UK and US is because the healthcare system there has been jeopardized. I will explain that. The primary healthcare system of every nation or any continent determines how successful the healthcare system is going to be. The healthcare system, the primary healthcare system in this country is almost zero. Now, it is there, but it's either they're not doing the right thing or we don't have people that will put what is meant to be done. But in the US, you cannot go to a hospital and just say, I want to see a hematologist, I want to see a gynecologist.
You know, go through a lot of tests.
Exactly. You need to pass through a particular kind of process. Yeah. Family physician, first point contact doctor, you need to see them. It is that family physician that will now give you the kind of coordinated, comprehensive, compassionate care that you need to follow through. And he or she is not going to follow you through that care, because that specialist has, a lot of patients. He needs to do what he needs to do. They hand you over back to the family physician or the primary care physician, and that's it. The reason why I'm going abroad is because, one, there's no job security. Yeah. Secondly, most doctors cannot even
lifespan.
No, it's not lifespan. It's the we like call it salary or remuneration. Yeah, it's not appropriate. I know doctors, I will not say they're suffering, yeah, but the clout around it is, this man is a doctor. People just expect that he has money.
It doesn't.
Yeah, so the bill comes with the name, but the financial capacity doesn't come with it. And it can be frustrating. Now, I'll quickly give you an example. I spent 8 years in medical school, yeah, and my colleagues who finished the 4-year courses, when I was getting out of medical school, some of them were like managers in banks, yeah, and I went for a 1-year training internship. Those guys were, so they came, and when you're working in bank way back then, they give an official car. They give. I could barely even buy a car. I couldn't even barely pay house rent.
Yeah, but for the love of life now. So let's say for the love of life.
Yeah, but for the love of life. At the same time, don't forget that I was going to get married. I was going to have kids. Those people have lives too, and I have bills to pay.
True.
And the economy, the Nigerian economy suits that. What I mean by that is, when you go abroad and you earn £4,000 a month, even if they take 1,000 as tax, the remaining £3,000, convert it to naira. Yeah, and that system over there, it suits them, because you can get a house loan, you can get a car loan. If the federal government, that's what they should be saying in the House
of Rep, not saying that they want to.
Let us equip these hospitals. Let us during COVID. Thank God COVID even came.
Oh, really?
Yeah, COVID was an eye opener for a lot of things. So that's it.
That's not it yet. I'm coming. The signals on 91.3 Lagos Talks. I have with me Dr. Diya Ololade, and we're talking the healthcare, ever-evolving sector. And if you have questions, comments, you can call us 0809. I'll tell you why I'm laughing, but let me just call the numbers. 009-191-3913 or 0809-234-5913 or WhatsApp 009-234-5913 or call 0151519113. Now, do you think so why was I laughing? I'm laughing because if our hospitals are not equipped, if we don't have doctors, if the doctor that you're seeing, and I know that at some point I was sick and I went to this, and then the doctor there was like, "Oh God, I'm going." I'm like, what's going to happen in the era where by the time you are not feeling fine, you're going to the pharmacy and people are prescribing drugs left, right, and center, and the short time that a doctor would attend to you is very, very low, in 5 minutes, and sometimes people are paying heavily and not getting the healthcare that they need.
Okay, so if I get your question correctly, just
we're losing doctors.
Yeah,
people are beginning to become mini doctors, mini nurses.
Yeah, there's now a chance for quacks.
Yes,
people who don't have the training as medical practitioners are now beginning to take that space. So now, I will not tell you that I have a solution for that, but I've actually preferred a couple of solutions to tell people what we need to do. Firstly, we need to begin to encourage most of these our young children, people who are just getting into universities,
to go back, doctor.
No, to go back and study medicine.
Medicine.
Yes.
Can we shorten that 8 years?
No. So that 8 years is not really enough. So that's why it's a practice. The reason why you're seeing my eyes like this, I had to be up late nights last night to study. It's an evolving academic exercise that you never graduate from. I have professors that were 82 and they were still coming to, they were fit as a fiddle and they were still giving us lectures. So what I'm trying to say in essence is that even in Nigeria, health policies are not helping. In America, you cannot go to a pharmacy and buy an antibiotic over the counter.
Okay.
It's impossible. Yeah. But you can walk into any pharmacy here and just even complain. I have a headache, I have body pain, I have this and that. See, no disrespect to pharmacists. They are fantastic pharmacists, clinical PharmDs and like doctors of pharmacies, but they don't have the training. The reason why I tell you they don't have training because there is a process before a doctor makes a provisional diagnosis. There are some investigations he will do before he now decides to prescribe a drug to you.
So are we sitting on a time bomb?
No. Well, so it's a time bomb that we can keep our fingers crossed and pray that.
Pray? Well, we don't say pray. Don't say pray. Pray. No.
The reason why I'm saying pray is that there are some things that are actually out of our own volition or jurisdiction.
Okay.
There are some things that's out of our power that we cannot do. Okay, let me give you a very quick example. Yeah, they are traditional birth attendants. Those people who deliver at home, Sikira. So she has been doing this for a long time. The experience is there. But there are one or two cases where the person has postpartum hemorrhage, that's bleeding after delivery. And she doesn't know how to sort that out. They now need to rush that individual to a hospital. Now, it doesn't make sense to any doctor. You didn't come to me in the first place. You scattered everything.
But your hood says you have to treat me.
Yeah, I will treat you.
Okay.
But it makes it difficult. Now, if anything goes wrong and another person dies in that hospital, they will not even hold the traditional birth attendant responsible.
The doctor.
So
that's health hazards.
Yes. And that's what is raising our maternal mortality, our infant mortality.
How can we reduce that?
So, personally, if you ask me, I know we're on live radio.
Personal.
So this is
personal.
This is Dr. Diya's.
No. Let's remove doctor. This is Lola Diya's personal opinion, not doctor. Because if you stand in doctor, you're already in an office.
Okay.
Right. So in your own personal.
Okay.
Because I'm about to ask you what you have not left off yet.
I think we need to begin to empower people.
Okay.
Yeah. So I'm also into the business of building hospitals. Yeah? I think we need to begin to empower people. What I mean by that is, for traditional birth attendants, a lot of people feel comfortable giving birth at home. Okay. Be it because of accessibility, it's close to their house. Be it affordability, they can't afford a hospital. Be it the fact that their friend told them that that's why I did mine, or you can go and do it, and So we need to begin to affiliate ourselves with these people, teach them health education, very, very important. Teach them the aseptic techniques and the little things they can do. Then also collaborate with them that if you get stuck at this point,
call us
or bring the patient to us immediately. That is one. Those traditional bone healers, I'm sure do you know them? Those yeah. So those guys without X-ray, without anything they have. So there are some people there are some patients that they have that they will sort out the legs or sort out the broken arm. Yeah, but there are some of them I have seen. It's short, not even some. There are lots. They come back with complications. There's necrosis in the bone. We need to go back in.
Sepsis.
Sepsis, break the bone again. Scrape it and do the appropriate thing. So we need to also tell those people that you need to know your boundaries. When it gets to this point, you've not done an X-ray. You can even empower them. Then they do X-ray because now it's getting to
the cases are getting
a lot, and it's getting too overwhelming for doctors. That is one of the things why. That's one of the reasons why doctors are running away. Also, you can imagine you as a house officer, you don't have any kind of clinical experience, just your basic medical knowledge, and you are asked to run a clinic. There's some doctors who they'll tell you to run a full clinic, so you'll not be doing it. You are calling, you are doing guessing, and so there are no health policies to actually. See, I will not lie to you. NMA, MDCN, AGPNPN, those medical associations are trying their best. They're trying to sort the issues out in-house, and they're trying to also sort it out. You cannot make everybody happy. Yeah. Again, lastly, is delegation. Delegation. The reason why I say delegation is our doctors are running away, nurses are running away too.
Yes.
Yeah. So now, what I think we should do is, I think we need to give people more to do under supervision. I'll explain that. What nurses are meant to do, nurses within their own jurisdiction, dress the bed, clean the patient, take vitals and all that. We can begin to choose community health extension workers to do the work of nurses. What I'm telling you is what happens in some countries. In America, there are nursing practitioners, or doctor physicians. There's something that they call them. So they have empowered these people to work within a particular jurisdiction under supervision. Okay. We can begin to do that, but that will still be
learning.
Yeah, trying to solve the problem from the back. The solution of whatever it is that is healthcare in this country has to be, nobody goes to university by skipping primary school and secondary school. Nobody.
So we've just skipped from primary.
So a lot of people are building, they are building tertiary hospitals. They are building the big hospitals, and they've abandoned the primary healthcare facility. In America, what they do is they make them as private as possible. They call them urgent cares. Yeah. So instead of you running to a big hospital, you can go to an urgent care, have a fever, you can do your blood test. It's a doctor that will still attend to you. It's easier than if.
But at least there's a family.
Yeah, exactly. Whatever it is you need to address, if you cannot address, you refer to a bigger one. Instead of allowing everybody to just walk into a big facility trying to. Everybody also wants to make money because finance is also a big key.
Well, just hold on. We'll go for this break, and when we come back, we'll quickly look at some things. It's still signals. Don't go anywhere. Wow. Okay. It's a big one. It's a big issue.
I used to tell people that I found the solution to healthcare problems in this country.
I'm coming. We'll start with that. Welcome back to Signals on 91.3. We're still talking healthcare, the ever-evolving sector with Diya Ololade, Dr. Diya Ololade. If you have questions, comments, send us a WhatsApp message or call us 0809-234-5913. 0809-234-5913, or call us 0809-191-3913. 0809-191-3913. Now, you said something while we're off air, and I'm going to take you from that. But before that, why have you stayed? Why have you not Tapa?
Okay, so
what has kept you? Before you do that, hello, good morning. Hello.
Hello, good morning.
Good morning. Your name or where are you calling us from?
My name is Mike. I'm calling from Sule.
Okay. Question or comment?
Can you hear me?
Yes, we can hear you.
I want to suggest something. I think you don't.
Hello. Hello. Please call back. Hello, good morning. Please call back because the questions are about to come and I have to pack everything together. Call us back 0809-191-3913. Hello, good morning.
Hello, good morning.
Good morning. Your name or where are you calling us from?
My name is Julius. I'm calling from Kenya.
Okay, question quickly. Question or comment?
Okay, I think it's a comment.
Okay.
Yeah. First of all, I want to thank your guest for the response you gave to something you raised.
Thank you very much.
I'm a clinical pharmacist.
Aha.
I spent 8 years to get my degree, and I've been learning things.
Good.
So the way you introduced pharmacists into the topic, I think it was kind of disrespectful. Pharmacists are not quack.
No, he didn't say that though.
No, he didn't say that. That's what I said. I said the way he responded to you. That I respect him for what his response. The way you brought it into the topic.
Thank you very much, sir.
Pharmacists are
no.
So let me explain. There are some people in America. I'm currently doing a course there now. In America, you have what we call pharmacist-initiated therapy.
Okay.
There are 2 stages to it. There's a training you get where you start handling certain cases. So if, for example, you did cardiology pharmacy and you are a specialist, so you can manage the cardiology patient on your own. Whereas if you have done your part 1, you can work in conjunction with a cardiologist.
Okay.
But by the time you have completed your program, you do not need the cardiologist to operate. So that's why you see pharmacists who do vaccination, pharmacists who do oncology treatment in America. But in Nigeria, we don't have that kind of specialist yet.
True.
We just got one some time ago when the federal government approved consultancy for pharmacists who have attained their postgraduate training in West African College of Pharmacy. But the Federal Ministry of Health and the NMA, they keep against it. So there's no one person that can fix the whole health problem.
Correct.
We have pharmacy technicians who assist in dispensing and many jobs.
Oga, I respect your work.
You need to bring him in.
See, I don't worry. I respect your. Let me pick other people's calls. I beg.
Okay.
Thank you very much, sir.
No, so it's almost like I'm in class. I'm the novice here. I'm almost like the patient asking questions. If you have questions, call us 0809. Okay. Hello. Good morning.
Hello. Good morning.
Good morning.
Morning. My name is Mike. I'm calling from Surrey.
Okay. Go ahead, please.
Okay. I just want to speak to an aspect of what the doctor was talking about the efforts of the medical
association.
Yes.
Okay.
Group. I've been with all the practitioners, medical practitioners. I would suggest you should go and read the Health Act that was signed by Jonathan. It is very detailed with a lot of stuff. Because the challenge is that a lot of our practitioners don't get involved in the process of when that act was being taught. And one of the things that unfortunately that has entrapped a sitting senator who is going to be for a mother is one of the things that is in the act. It's one of the things that is in the act. So the truth of the matter is this: I would suggest that our medical practitioners to go and read that act. The devil is in the details of that act. There are so many things that a lot of medical practitioners are very ignorant of. I would suggest they read that act.
Okay, then. Thank you so much.
Yes.
Thank you very much.
Can I say something?
Yeah.
So I agree completely with him. Yeah. Now the thing is, it's burdensome enough. Yeah, as a physician, that your work is too much to do already. Yeah, and now getting yourself involved in all those associations, participating fully, reading this act. There are a lot of I've read this act before, but I can tell you for free that I can't even remember not half of it, the basic things that he is trying to point out. Yeah, there's a particular point to get to in healthcare in Nigeria, which is one thing, a space. Understand very well, yeah, without reading these things or getting yourself intertwined with these things daily, and if you read anything and you don't practice it regularly, or the environment does not support these policies, you don't use them, or you don't apply them, you want to apply them, but everybody else is telling you that, what are you doing? I beg, face front and leave what these guys are doing. You're just wasting your time. There are a lot of policies, there are lots of things that not only favor the doctors, it favors even the patient's rights, everything, but
is it that we are in a country where we don't take things to heart, and then we just feel that the Nigerianness.
Yeah, so if you say Nigerianness, you're making it sound bad. Yeah, so don't be like that. Don't be like that.
I'm trying. And what I mean in Nigerianness, not in a. People have lost their lives. I remember someone very close to me who and so good.
No, please, I'm apologizing on behalf of the healthcare.
We had to buy, and this is very close to home. We had to buy fuel for the hospital.
Yeah, so those are the little things that should not even be said.
Yes,
it's impossible. When you go to a teaching hospital, you need to buy drip, buy plaster, buy all those things shouldn't be. But like I said, I told you there's a solution to all this. Yeah, but okay, so
please don't go yet. Don't travel. Don't jump yet.
I think in Nigeria,
so I can call and everybody.
I think in Nigeria the problem is accountability. doctors need to, in America, if you're a physician, either an O&G specialist or whatever it is, you are going to be held accountable for whatever it is that you do.
I'm coming first. Hello, good morning. Send us WhatsApp messages, please. 0809-234-5913. It's health, and everybody's, even me, my temper is all small. I'm listening to you.
Yeah, so what I'm trying to say in essence is that people need to be held accountable for what they do. It's not every doctor that is incompetent. It's not every doctor that is negligent. We're all human beings. Nobody is an island of knowledge. Yeah, but at the same time, this is my own trick, and I tell everybody who wants to listen. If I see you as a patient, as an individual, firstly, I'm not seeing the disease. You hear people say, that woman with cholera, or that woman with that autistic child, you know. First of all, that is out of place. Okay. Secondly, I treat every individual the way I would treat my mom, my wife, or my children. If you do that, if all doctors do that, they will be able to, because I'll just give an example. Yeah, something happened in Ibadan, and you know, there was this lady. I heard she was a first class lady that she had I don't know what she had. I think she had a heart attack. You know, it was a TIA, a transient ischemic attack, something like a mini stroke. So they went to a teaching hospital, and the lady at the reception who was meant to register them was eating her breakfast, and she said she should go and sit down and let her finish her food. Yeah, the lady sat down.
And she died.
Yeah, she died.
Okay, I'm coming. I'm coming first. I'm coming. Hello, good morning. Hello.
Hello. Yeah. Okay. Mind calling again. I just want to say something. Do you know in the Health Act that the specification of what qualifies as a hospital is detailed in it?
I think we're good. Yeah.
There's a lot of structures that you have that is being used as hospital. If you go according to the specification in the Health Act, they don't qualify for a hospital.
I agree.
At all in Nigeria.
Thank you.
Because the standard, what they height from the floor to the roof, the specification of the length from the floor of the building to the height of where it should reach is purely specified in that way. The way medicine is practiced in Nigeria is very, very different from every other place.
It's Nigeria.
Very different.
Okay.
Very, very.
I wanted
to. Go ahead.
So
to him.
Yeah. So now the thing is, he's very, very correct. Yeah, he's absolutely correct. And from
is it that we need to be putting the Health Act in all the hospitals so that
no. They are health. So there are agencies that ensure that most of these things are put in place. Yeah. There are there's the JCI, the COSASA, the Safe Care. There are agencies that ensure that hospitals are get the particular specifications or whatever it is they are doing. But when you get to places like Agege, Alimosho,
Ikorodu,
you know, maybe those guys don't get to that place. But myself, when I pass and I said, they tell me that's the hospital. I'm afraid. I'm afraid for my
now. So this leads me to almost my final question. Where do we draw the line between somebody who is very passionate, because you're a passionate doctor, between somebody who is passionate and who is into the hospital to just make money?
It's a thin line. You know why? You don't want to say it's a thin line. It's a thin line because I don't want to use the word scam. I think I was scammed into being a doctor. I think I would have been a very good music artist or a footballer.
No, I think because you saw your dad. I think we should thank Daddy first.
So the thin line behind it is
just like saying we have passionate teachers and not passionate.
So the passion is there. If you are lucky enough, you will be able to. So there is a business side of medicine which they don't teach us in medical school.
Okay.
Yeah. Even as I'm speaking to you, I still have not gotten the business side right. So what I tried to do was, instead of getting medical mentors, I tried to get financial mentors. There are people who are top on the owners of banks, owners of financial. These guys understand how money works. Okay. Yeah. I see. The only thing I see is 10 milligram per kg, and but these guys understand that if you put this money here, it goes there. So I started, and they're older than I am. Mm. So I started talking to them. I started following them. Because I needed to understand, because the main problem of healthcare, even abroad, is finance.
It's finance.
It's finance.
Okay. So, because my time is up, what's the future of healthcare?
Okay, the future of before we can talk about the future of healthcare,
The present care. Let's see what's the present.
Okay.
What do we do right now?
Okay, before we talk about the future of healthcare, we need to know what the present
And the
state of
past.
healthcare is. In Nigeria,
Over 10.
No, so I'm going. I think we are like 25 years behind. Yeah, and we need to catch up. No healthcare system in the US, in the UK, in all those European countries are getting it 100%, but you know that they are taking steps in the right direction. So we need to do that. So we don't need people now coming to say that we'll now keep the doctors here by force for 5 years, and those are not the right steps to take. I'm sorry,
it's okay
sorry,
because
it's
because 5 years keeping it not
you just discourage everybody else, and everybody will just go to Twitter and go and do what they want to do.
Yeah, okay.
Yeah, if you
Before
understand
we take them to Twitter, let's so present care is
so we're years behind. Yeah.
How do we catch up?
A lot of work needs to be done. A lot of work, and it's not only by medical practitioners. It's not only by the federal government. It's not only by the agencies. It has to be It has to be a combined effort kind of thing. Because even Nigerians are losing trust in doctors.
Yeah.
Some people say, "I beg, I'm not going to that hospital. I don't like that doctor. He gave me malaria drug." Some people rather even go to a pharmacy and take their chance. They know it's a risk,
but they would rather take their chance.
They rather take their chance there because. So
you don't want to. Yeah, well,
what we are going to what we plan to do is for like shows like this. I'm planning to actually start a radio show or a TV show.
You will get overwhelmed already. Be coming. We're waiting for you.
Or a TV show where we can ask people. So I like. Is it Mr. Mike?
Yes.
Yes. So I love his feedback. If doctors are watching this, I'm going to go back and read my health act. Yeah. So there are a couple of things that I read then that didn't make sense to me. But with this position that I've gotten to now, I have to pick it up and say, okay, fine. I think this makes sense. This makes sense.
You should put the health act everywhere in the hospitals. That way, because my time is up. Thank you so much, everyone who has called in. Thank you, Dr. Diya.
Thank you for having me.
Dr. Diya Ololade, Director Atlantis Pediatric Hospital and CEO Platinum. Celebrity Platinum Hospital, because I got calls immediately. Group, I got calls that we know him. I said, okay, fine. Thank you so much to everyone who's tuned in and called in. Like we always say on Signals, and I recently started to say that great can come from anywhere, and create opportunities for people because people will be people. Please start creating the opportunities. Have a wonderful weekend, God bless. Thank you too. And you cannot.